It is 2/1/2021. About to call in block. Yeah.
Hello.
Hey, Ann Scott. Yeah. How are you doing today?
I'm doing fine. How about yourself?
Good. I was able to walk to the park today. It was pretty nice outside.
Well, good. I'm glad to hear that.
Right.
So you got the report?
I did. It's weird reading that because it sounds like the grammar's all messed up and some of the facts aren't even right. But oh well, I guess. But overall, I mean, what is? I know chronic means 1 or 2 months old, but what is? So is it just showing one clot in one vein, or do I still have clots in multiple veins?
Let me pull up the report before I answer that question.
Because I know on the ER paperwork it said like I had like 4 different veins. I said I had clots in, so I don't know. I mean,
that was way back then. I mean that was the blood clot, in all of those veins.
Okay.
Yeah. So, and I am reluctant to give a medical report to a patient because there are a lot of things in there that are not easily understood.
Yeah, I was just going to Google a lot of it, but I figured I'd call you and just ask, kind of in a.
Well, no, I know, but even when you Google it, kind of.
Yeah, I know, but yeah.
Yours is complicated. There is no question about it.
All right. But it's nice.
Okay.
Yeah, but thank you for trying to reach out for a PT in my area. That'd be great.
Yeah. Do you have one that you know of?
I don't. I mean, I can ask around, but just what area. I mean, I don't mind.
Several.
Yeah, I don't mind driving a little bit if I need to, but.
I looked like in the Highland Park area where you said you live.
Yep.
There were several, so there's no reason. If she approves it, there's no reason you have to drive halfway.
Right. Yeah.
Secure Dallas and all that. So, let me see if I can find what you were. Okay. So, it did the Doppler or the duplex venous scanning reviewed, showing chronic thrombus of the right femoral popliteal veins and the tibio-perineal vein. So it looks like
the last vein you talked about. Which one is that? Because I know the popliteal one is the blood going out of my foot, which is the main vein underneath my knee, which explained why all the pain was there. But what was that last vein? I mean, is it?
What is the what?
That the last part that you said on the last vein you talked about.
The popliteal vein.
The popliteal is the one going out, right? The blood going out, right?
No, that is the name of a vein.
Oh, okay.
So that's what I'm saying. It's very confusing. And I do not know the name of every one of those little veins, but I'm just saying it can be confusing for the patients, especially. Okay, but those are the names of the veins.
Right.
I should pull up a picture of the popliteal vein so I can tell you
because
exactly what it is.
The popular whatever vein is, I know that's the main vein with the circulation going out of my leg, and that goes to my lungs and my heart. That's why I had PE, and
correct.
And that's why my underneath my knee hurt so bad because that's that vein right there. But You said there's another vein. I don't know where that vein is.
Well, there's just a whole bunch of them.
Oh, is there? Okay.
there's more than one, but it looks like from his interpretation. Now, I'm going with his interpretation of a skate.
Okay.
Okay. And he said, which means, yours went like from your ankle up to mid-thigh.
Yes. Yep, I know that.
And I told you that your body would absorb it.
Right.
And it takes quite a while for your body to absorb it.
Right.
So it looks like, though, that your body has absorbed most of it.
That's good.
That is good. You do have, still some, what he refers to as a chronic thrombus of the right femoral popliteal veins. So those are those big veins that you said,
right,
that you had looked up. Okay. So there's still some left. That doesn't mean that it won't absorb. It just will take, some more time. Look how long it's taken.
Right. Yeah, I mean, the lady from the ultrasound said it'll take months, so.
So, certainly, as much, activity as you can tolerate helps.
Right. So, I like I said,
And,
I'm starting to walk a little bit, so.
Just, I know, I'm glad to hear that.
Right.
That'll help you. Once you get started on therapy, that'll help you too.
Right. And
I sent the report to Arlinda, and I asked her, if I could schedule you therapy elsewhere.
Okay.
So I'm just waiting to hear back from her. The compression stockings, we do need to get those.
Yeah, so the one I got.
The one you got is not.
It's not
I
good.
don't know if it's enough.
Well, the one I got is open-toed, but it's half foot.
Okay.
It's half foot to my knee. So when I put that on, the swelling gets really, really big and tight from my middle of my foot towards my toes. Yeah, so I think I need to find one that goes from like maybe to the very bottom of my toes to my knee. Because that 3 or 4 inches, I mean, it was just, and it took almost 2 days for that one area, the swelling, to go away. Because it swelled up so much.
Okay, well, the compression stockings that he's referring to are medical grade.
Okay, so yeah.
They're not stockings that you can, you were in the right, you were going in the right direction as far as getting compression stockings. But these are medical grade, 20 to 30, whatever they call it.
Okay.
So I will need to acquire those, or you will need to acquire those, either through the therapist. Sometimes the therapists have them, sometimes they don't. I'll have to ask.
Okay.
Or I'll have to go through a durable medical equipment provider has those compression stockings.
Okay.
And they'll just mail them to you.
Okay, just let me know, and I'll
I have to find out from Arlinda what she wants me to do about that. So, anyway, hopefully she'll get back with me. But it sounds like you're doing great, though, as far as being able to move around a little bit. Well, what about the pain?
Pain tolerance is probably right now. It's probably about a 4 to 5 at night. So it's not.
Okay.
It's not really intense what it was, but if my foot swells up to the point where it's real tight, then I know I have to take pain medicine at night just to relax and then get down. But if it doesn't, then I'm okay. I don't take the pain medicine at night then, because I try to use my foot and everything. I try to walk. I try to do stuff, and then some days it's just the swelling is real tight. Some days it's not. And I don't quite get that yet. So, but anyway, I know the swelling is still part of it. Right.
There's no rhyme or reason to it, okay?
Right.
Doesn't mean that you've done anything that, made it worse one day or the next.
There was one day that...
how your body healed.
There was one day that I did have pain when I was breathing, but it went away. So, I mean, it was there for maybe, I would say, 10, 15 minutes, and it got my attention, and then, but it didn't went away. So I don't know if just little pieces went through and then dispersed, or I don't know. So, but it didn't happen again.
Since you've been on the anti-coagulation medication for as long as you have, I wouldn't expect you to throw a clot.
Okay.
Another clot, but certainly if it lasts any length of time, then you need to.
Right.
Yeah. So that was probably just.
It could be a fluke. I don't know what it was, but like I said, it didn't last that long, so I didn't.
Yeah.
At first I was kind of like, they wanted my anxiety level go up a little higher, but I just tried to just breathe normal and see if it continued.
Yeah.
And it didn't. It went away. So.
Right. Okay. And that's okay. Everybody would be concerned about that if they had what you had.
Right.
Believe me, everybody would be. That is. But I wouldn't expect it to happen now just because you've been on the medication for so long.
Yeah, that's what he said. He said now it's mostly scar tissue. Once the clot builds up and solid, it takes a while for it to dissolve, and then it becomes scar tissue.
It does.
So.
That is correct. So, and I'm hoping that all of that.
I'm hoping it all. Yeah, I'm hoping it all will dissolve, so that way you ain't got to worry about any blockage from that. So.
Exactly. So I hope so too. And I know there's things that you can do. Go in there and surgically do things.
but my mom was like all that. She was like, "Oh well, wait, why not this? Why not that?" And he goes, "No, competition is not worth the risk." And she goes, "Oh, okay."
As young as you are, I think it's going to absorb because you're young and you're going to be able to move more and more.
Yeah, but my family's the same way. They as soon as they found out, they start Googling it. So Google has a lot of good and bad information out there. So yeah,
just be careful.
I know. I just great positive, keep my head up high and just continue to do my daily activities. Now I can actually run the sweeper and stuff like that. So that's pretty good. So.
Well, I'm hoping you can see a little bit of light at the end of the tunnel now.
Yeah, I can.
Because I really feel like now did you make an appointment to go back to see him in 4 weeks?
No, I did not yet. So that's the one thing we need to do. I noticed that my next appointment's on 3 January, February, March or April. So we need to make sure we get that. I can call tomorrow if you want and see if I can reschedule that.
That's fine. Yeah, that'll be fine.
Because I also wanted to see.
He did not send the Amazon paperwork, but he clearly put in your report that you're to stay off duty for 4 weeks. So
right.
Hopefully that'll cover it. Maybe they'll send it to me later. I can't tell you how many doctors just don't. They're just overwhelmed by that Amazon return to work thing, and they don't have to be, but it looks intimidating.
It does. I mean, it's crazy.
It is. It's ridiculous. So he's not the only one. We'll just stay after him. So.
Okay.
But at least we got his report. That was the main thing. I needed the therapy recommendation, and I needed the recommendation for your compression stockings.
Okay. And then I'll also try to see if they can. I guess I got to call in and have them put my medical records online. So I'm gonna call and do that too. And that way, if I have access to that, then I'll send you those.
Okay.
See if anything helps. I guess on my end. So.
Okay. That's fine.
I appreciate it.
And I'll let you know about the therapy and the stockings.
Okay. I appreciate your help today. I really do. Thank you.
You're welcome.
All right.
You're welcome. You're doing great.
Right.
And I'm thrilled.
Awesome.
So, just keep on, okay?
I'll do that. You have a great day.
You too. Bye-bye.
Bye-bye. And it's 5:52 p.m. and it was Ann Block.